Thank you, Justin, for that introduction. I'm so thrilled to be here with you all this evening to talk about the amazing work of Crossover Healthcare Ministry. I obviously would much rather be in person with you, hugging and handshaking. But I feel like for this season, this is one of the small ways we can all do our part to try to keep this pandemic at bay. As a health department, when we are not coordinating the region's response to a pandemic, one of our core functions is to assure that people, and particularly low-income individuals, have access to high-quality healthcare. And this is no small feat, but it is made immeasurably easier by the existence of crossover. And I can't tell you how many times over the years I've wished I could snap my fingers and crossover would double or triple in size, because I think this crossover is exactly what we need to meet the healthcare needs of the and underinsured folks in our region. And so I'm so thankful to have them as a partner in my professional capacity. I'm so indebted to the work that has gone into this ministry over the years. But I also have a deep personal connection to Crossover. Mike Murchie, who is the medical director here, and I have known each other for almost 20 years since we were in med school together. And there was a season in medical school where once a month we would meet at the house of Cullen Rivers, one of the original founders of Crossover. And Cullen and his wife Faye would just nurture us and care for us and feed us really well. But they loved us through the intense time of medical school. And there's no doubt that that time anchored us to the city and this community, but also to this incredible ministry at Crossover. Some of you who work at Crossover may know Danielle Avula. And just to clarify, my parents did not name their children Danny and Danielle. Danielle is actually married to my brother, John. She's my sister-in-law. And by all accounts, she is a fantastic physician and colleague, and an even better sister-in-law. And I'm so thankful that she's now a part of the Crossover team. And Danielle and I and my brother John, who's also a physician, had all had during medical school our own connections and intersections, either doing rotations or volunteering at Crossover during that time. And it was really formational. For me, this was 17 years ago when I did a rotation as a med student. And it was one of the first places that I saw where the providers were doing really thoughtful, holistic care with low-income families. They really understood the deeper needs of their patients beyond just like the management of a medical condition. They understood how connected an individual or a family's health was to things like housing and employment, and yes, healthcare, but also behavioral health and other support services. And they would consider all of that in a larger relational and social and spiritual context. And so this was really an education for me on the social determinants of health before that was even a thing. And so I really do think for me, my brother John, Danielle, Mike, and countless other current and future health professionals, Crossover continues to shape the way that we understand what it means to care for people in need, that it helps us to see the complexity of their whole lives, the interconnectedness of all of these different factors, and to offer care with compassion and dignity and love. So really, I'm just so indebted to Crossover on so many different levels. Let me talk for a few minutes about where we are with COVID in our region. As many of you know, this has been just an incredibly challenging time for those of us in healthcare, but really the entire world. And, it's interesting when I talk to people who haven't necessarily been on the front lines or worked in hospitals or been personally impacted by this, they ask the question, what's the big deal? People are getting sick, but they get better. And by and large, that's true. But for many of us who are seeing the impact in nursing homes or working in clinics or hospitals and seeing just how different and acute and significant the impact of COVID is, this is really unlike anything we have ever seen in our lifetime. Uh, and I think the other side of this is that throughout this pandemic, we have seen that Black and Latino and other minority groups have borne a disproportionate burden of the health impacts of this, whether that is the number of people who have contracted COVID, the number of people who have been hospitalized with COVID, or the number of people who have lost their lives to COVID. And this is exactly these are the patient populations that Crossover sees. And there's a bunch of reasons for that. For mostly low income minority residents, we find that they are disproportionately working in frontline jobs. They don't have the ability to telework or work from behind a phone or a computer, and so the nature of their jobs is putting them in situations where they're at greater risk to contract the disease. What we've seen over and over is that people are more likely to work when sick because they need the income and they're worried about losing their job if they don't show up for work. And in some cases, it's actually been employers that have put pressure on particularly undocumented residents to come to work regardless of whether they're having symptoms or not. For some families who live in multi-generational households, who live in multi-families in a small space, it becomes really difficult to effectively isolate and quarantine. And so we see clusters of illness spread quickly in those scenarios. And for those with kids who are now dealing with virtual education and trying to figure out, they don't have the additional income needed for childcare to provide guidance for young kids who are trying to learn virtually. And then for those who are not English speakers, the language barriers in the midst of all of this, whether it's mask wearing or the eventual arrival of a vaccine or trying to navigate virtual education, all of that is just so much more challenging. And so these things have resulted in a double impact on these communities. One, the health impact, the fact that, again, higher rates of disease, higher numbers of folks hospitalized, and more people who have lost their lives in Black, Latino, and other minority groups, but also higher unemployment rates and a loss of stable housing, folks who are struggling to access food and other social supports, and now with virtual schooling are going to fall further and further behind in school. And so, this is not something that once COVID goes away, everything will go back to normal. This is creating long-standing furthering of health and social and educational disparities. And so what role do places like Crossover have in this response? Well, Crossover has an incredible relationship with the communities that it serves. They have a remarkable amount of trust with patients who really don't trust institutions. They don't trust government. And so it's a really unique thing to have a healthcare provider that thinks so holistically and that you trust implicitly. One of our major challenges throughout this has been to try to share information in certain pockets of the population, whether it's about the importance of COVID testing or the importance of wearing masks. And we have struggled to get into communities where they're non-English speaking, and the government or the health department have not previously had a role or a presence. But Crossover is different. Over 50% of the patients here are Spanish speaking. And when you look across the board, there are 42 different language groups that are served by this amazing place. And so that reach and that presence and that relationship puts Crossover in a position to connect and to support and to help these communities as they try to navigate what's going on with COVID-19. Additionally, the work that Crossover has done prior to the pandemic and what they're doing, through and after is also incredibly important. The direct healthcare services to uninsured individuals is keeping people out of emergency rooms so that they won't be overwhelmed. The provision of prescriptions on site makes it easier for patients to get what they need and not have to make unnecessary trips and have even more exposures when they're feeling ill. By continuing to treat pregnant and postpartum women, Crossover is helping them feel prepared and supported, and eliminating stress in what's already a really stressful time of life, both pregnancy, but then doing that in the midst of COVID. And as we head now into the fall, there's a whole nother host of things that we've got to face. This potential, another round of COVID, another peak of COVID, the potential double impact of flu and other circulating respiratory disease. on the non-health side, the fact that more and more kids are trying to figure out how to learn virtually, and what are the impacts, particularly for young kids, to spend that many hours in front of a screen. Um, uh, there's so many things that are unfolding as we head into the fall. And I think many are hoping that a vaccine will arrive and kind of make all of this disappear. But unfortunately, I don't think it's that simple. I think we will have a vaccine, and we will have a vaccine faster than um, we've ever been able to do that. There's just never been a time in history where we've had so much money and focused energy on the creation of a solution to something, and the information sharing, the ramping up of technology has really been remarkable in the world's vaccine response. But there are historical realities to how people will feel about vaccination. We know that African American communities will be very distrustful. We know that non-English speaking communities will take a different approach. So again, crossover will play a really important role in preparing the community for vaccination and for next steps as we all try to progress beyond this COVID era. I could go on all day about how grateful I am for all of the things that Crossover does, but you're about to watch a video that does a really phenomenal job of capturing this incredible ministry's work. So I'm going to stop here and just say once again, thank you to everyone at Crossover Healthcare Ministry. Thank you for your partnership. Thank you for your incredible dedication and service. And I hope that those of you who are watching this just enjoy this snapshot of what Crossover has been doing in the midst of their COVID-19 response.